Great to see you all virtually. So appreciate the opportunity to come to you and give an update. I'm Brenda Graylish. I'm the Executive Director for the Commission for Behavioral Health. Teresa, I know we didn't really get a chance to talk beforehand. Are you just interested in me kind of giving updates on what's happening here in the Commission?
Um, right. I think in particular, upcoming funding like grants and things like that are interesting, or if you have some results from some of your other grant programs that you've done. I know you have like, I don't know how many initiatives, 25 or something going on at once.
Yeah, we're busy, for sure. Okay, that's helpful. So, well, I can tell you we have our peer respite that's about ready to be released for RFP, and another one for our Behavioral Health Student Services Act performance management, looking for a contractor to help some of the local education agencies build out local basically data management systems that could be used for doing continuous quality improvement. So we've got those two that are right on the horizon. What's really big on the horizon and within the next month is our Innovation Partnership Fund. That's a new grant program that we're going to be administering. We have, as a result of the transition from MHSA to BHSA, the Commission Innovation, which used to be at the county level, is now at the state level. And it lies here with us at the Commission. We get an allocation of up to $20 million per year for the next 5 years to try innovative programs and practices that can be, well, one of the goals is to try to scale them. And really the focus is to try to help the counties serve the BHSA priority populations. And so, so that project can either be, we're looking for projects that can either directly help counties or look for projects that could alleviate pressure off the counties, so preventing folks from even ever needing that level of care. So, and it's quite a flexible grant program to try innovative programs and practices. So that will be released probably late February, early March. Our commission just yesterday voted for all $20 million to go out to this grant program. So we'll be releasing that RFP soon. So I think those are the big grants that we have right on the horizon. We did a couple of intent to awards yesterday as well. One of them being, I believe, our 0 to 5 technical assistance. We have a maternal behavioral health contractors that we started last July. And so we're just bringing on a technical assistance provider to help them. So that intent to award went out yesterday. And then we also did an intent to award for that same kind of performance management system that I was just discussing for the schools, to have that for county behavioral health and their providers for full service partners. So we did that intent to award yesterday as well. So looking forward to getting those projects off the ground. We've also got some projects in the works for our Behavioral Health Services Act that we're, Behavioral Health Student Services Act, really looking to start integrating substance use disorder services in the school programs within our Behavioral Health Student Services Act grants that we have. We grant the counties, and then they partner with the local education agencies and school districts. And so with the spirit of SUD being a standalone, substance use disorders being a standalone as part of the BHSA, we're looking to expand that work within our portfolio as well. So so those are the big updates in that space. I will say we are working on an interagency agreement with the Planning Council and CALBHB CVCs for kind of trying to broaden and make sure that we're all staying coordinated. So excited about that. That is being worked on right now in our emails. So excited to get that in place because we've been talking about that for a while. And then our commission just met yesterday and today. And beyond some of the things that I've already talked about so far, we are also embarking on an update of our strategic plan. So if anybody's interested in that and coming to our meetings, we've just established a new time-limited strategic plan update committee And this is going to help us as we move from, again, MHSA to BHSA, and really working to identify the priorities for this commission to work on. So if anybody's interested in helping us set those priorities, you're welcome. I invite you to keep an eye out on our website, or you can go on our main page for our website. At the bottom of the page, there's a place you can put your email address to get updates on our upcoming meetings. And we always welcome folks to come join in our conversations to help shape our work. So, and then upcoming, we have our, the way we're structured is we have our full committee that meets bi-monthly, and then we have several subcommittees that also meet bi-monthly on the off months of the full commission meetings. A few of our key committees are our Program Advisory Committee, our Budget and Fiscal Advisory Committee, and our Legislation and External Affairs Committee. And we also have a Client and Family Member and Cultural Competence. Our two committees joined together, and they're meeting now as one entity. And so these folks are really working on a variety, weighing in on a variety of our different projects and helping to shape our different projects that we're working on. So if anybody has an interest in joining our committee meetings, we'll be holding our next round of committee meetings in late February. We are still trying to figure out our agendas for all of those meetings. One of the things that's top of mind for us is our data strategy. So we at the commission get quite a bit of data from a variety of sources, and we have dashboards that we've been working on in the last several months. And so now that they're kind of baked, we think they're getting ready for prime time. So we want to start socializing those and getting folks aware of them, weighing in on them, so that we can get those posted, and people can have data available to them to be able to use in their work. So I know there's been a lot done with like children in full service partnerships and data matching with the Department of Education, but we've also been trying to think about what data we can make available to help counties and community members with their Behavioral Health Services Act planning efforts. And I know that's quite a ways down the way, and like that's kind of, that horse is out of the barn. There's a lot of planning that's already been going on, but because the draft plans are due, the integrated plans are due in March. But having been somebody that's worked in these systems for decades, it's, there's no late time to start on new initiatives or new efforts, because even if we're missing timing now, it'll be helpful in the out years and help us to continue with our thinking and our refinement of our data that we put out. And then I know, I think maybe some of you guys might have been involved in some of the work for developing our Behavioral Health Services Act Community Planning Toolkit. So big thank you to any of you who have participated in those conversations and helped shape that toolkit. We're seeing that toolkit as, again, not a one and done type of thing. And we know that, it's a little bit later in coming to help folks that are engaged in the planning process. But again, anytime's a good time to do something and start somewhere. So we're trying to get that out as fast as possible. I think within the next couple of weeks, so that people can start using that, and then we can start getting some feedback. And again, even if it misses this 3-year planning cycle, we want to be able to have it available for the annual updates and ready for the next 3-year cycle. So we've been working pretty hard at that, and then we'll be we're looking into trying to get it translated as a piece of feedback that we got from as we've been working with stakeholders on it. And so we're trying to see if we can find funds to help us translate it into different languages to make that available to a broader range of our audience and our folks, community members who need that information. So I know that's a lot of information that we've put together. Our next full commission meeting is going to be in late March. Always welcome to have folks there. Of course, we don't want to conflict with anyone else's meetings. I think this time we happen to conflict with the Planning Council. It's just kind of the way things worked out, but we try to make sure that we stay coordinated. And I'm happy to take questions if anybody has any.
Yeah, we have a question. I see a question in the room, but as the microphone makes its way, I was wondering if you had decided on any legislation, if you were going to be sponsoring or supporting legislation, if you knew about any yet.
Yep. And thank you for the question. Well, we're still looking at the legislation we would sponsor. That work happens in our Legislative and External Affairs Committee, which again will be meeting in February. As far as our own legislation that we're working on right now, is we're working on legislation related to suicide prevention training. And that also kind of relates to some of the work that the commission has done under the Behavioral Health Student Services Act. So we were made aware that there's some training that had one-time funding, and then so we're looking to pick up where others left off and expand on that. We're also looking to potentially get data from that as well, because we were hearing that there's suicide prevention screenings happening in schools, but there's no central repository for those data. So we're looking at that as well. So.
Okay, question in the room. We have, go ahead and introduce.
I'm Christine Hotta, Napa County. The database you're talking about, is that supposed to have county level data?
Which database are you talking about? Our data visualization or the database I was just talking about for the
database you were just talking about?
Oh, that's a TB. There's no specifics about that. And I think it's actually from schools. So it would be coming from schools.
Well, I will just say that the California Healthy School database is really impossible to negotiate. Supposedly you can do it by county, but you have to do it question by question, and only your county and not the total. Anyway, so my point is,
you're flagging
if you do anything, please make it easy to navigate.
Got it. Thank you.
Okay. Does anybody else have questions? Anybody online?
We have a question here.
Oh, another one in the room.
Hi, Brenda. Steve McNally.
Oh, hey, Steve.
Good to see you. So we didn't have.
You.
Yeah, I don't get the. So I was here at the Planning Council for some of their meetings. So when you had the panel today with all those great ladies, one of the things that CBHCA did was they sent a letter to DHCS. I don't know if they came up in your panel about Department of Public Health, I'm sorry, asking them not to spend so much money on statewide initiatives and return some of that money to the local nonprofits, especially the CDEPs and people like you were getting funded that are no longer funded. So I don't know if that came up, and I don't know if anybody will listen to that request, but one thing that came up for me was everyone writes letters that no one else sees. And many of us aren't at the tables, and the same people, there's a small group of people that are very deep in everything, and there's most people know nothing about anything. So anything you can do to help us with that would be helpful.
Yeah, and thanks. That was that prevention panel that Steve's talking about that we had this morning, because prevention, that landscape has been changing from the MHSA to BHSA, has been really confusing for a lot of folks, and or there's people with concerns. And so one of the things the commission tries to do is provide a venue or a forum to have conversations where we can bring folks together and the public together to have these conversations. And yes, CBHD was there, and I don't recall Steve, Michelle talking about that particular letter. I was in charge of doing time and a few other things during that time, so I could have missed it, but I don't think she mentioned that. But to your point about, yes, people write letters, and we get them, others get them as well. And so it sounds like that went to CDPH, and so they would have to process that and determine.
Right. So what happens is we can never figure out who's on the same, agree. So it's a good way of keeping us siloed. And it was CBHA. It was Leandra Clark's area.
Oh, it was CBHA?
Yeah.
Oh, okay. Yeah, and I think one thing is one thing I try to do is try to network and stay connected to folks. And so I try to keep my finger on the pulse as much as possible by just being involved in those conversations, just to see what's going on. And sometimes as a result of that, I will be CC'd on some things, so then we're in the know. I had not heard of that.